Thank you very much, Natalie. So I'm Peter Allebeck, Professor of Social Medicine at the Karolinska Institute in Stockholm, and I've been involved in the joint programming since a number of years when I was also Secretary General of our Research Council, who is one member. So I've been a chair now since about 2 years. And I don't think I need to explain the joint programming, just to summarize that we are a network, about 16 member organizations from Europe, but also outside Europe. And we are especially glad to have Canada as a very active member. So good that Jennifer could join us. And our aim is to, of course, strengthen and support and coordinate research on demographic change, which is basically the aging of the population, but also migration and issues related to both health issues, but also other social consequences of demographic change. Now, when the COVID pandemic came, we of course thought that we could not neglect that. So we have discussed at various rounds, what could we do in addition to what is done everywhere else and in all sorts of topics and disciplines. So Natalie and the SOAB had a discussion, and I think that this concept of knowledge sharing activity is good, because we have not set in stone what and how this activity is going to be run. But I think it was decided to start with the topic of loneliness, about the elderly and social isolation, which really has been a challenge in my country, which is considered to be an outlier, that we did not have so strict restriction. I would say that for the group above 70, they were more restricted than in many other countries, because they were more or less forced to stay at home, whereas other parts of the population had less restrictions. So I think that we all have various experience from our country on to what extent and how the COVID has affected the older adults and also the oldest old. Now, you know probably that we have various instruments to work with. We have the classical calls project running for 3 or 4 years, and we have a number of them going on right now. We have the so-called fast tracks, which is a shorter time, around 6 months, rapid synthesis of evidence to inform policy. And now it seems that we are introducing new instruments, and this knowledge sharing activity, I think it's a very good name, because it associates to knowledge, of course, but also to sharing knowledge. And all our research should be very close to policy relevant, but also that findings should be disseminated and shared with policymakers and stakeholders, so that you have this knowledge sharing in the heading, in the terminology of this activity. I think is very promising. So again, thank you, Natalie and the SOAB, for having taken the initiative to start this work. And please, Natalie, back to you to explain a little more the background and how you view the activity. Also, Natalie, your voice is a little weak, so perhaps you can speak closer to the microphone also. So again, welcome very much.